Hello, this is the first lecture of a series of lectures in which I will talk about the Blue Sky Plan software. In these lectures, you will learn the fundamentals of this program and how to import the data from the intraoral scanner and make a model with a base and articulate them. Then we will learn how to design crown and fix bridges, and finally, we will learn how to export the design so it will be ready for printing. When we first open the program, we'll be presented with this window, which has all these options, including orthodontics, splinting, implant, dentures, crown and bridge. But first, we have to create a model from the data obtained from the intraoral scanner. So we have to go to Model Master. This window will appear, which has the Import Model option, in which we'll import the scan data, and the Open Recent File option. We don't have any files, so we will go to the Import Model option and click it. This window will appear, in which we'll search exactly where we put the data. Here is the data. This is the mandibular data. As you can see here, this is a preview of the data. Then we press Shift on the keyboard and select the maxillary and occlusal data and click OK. This window will appear, which has all the imported data. This is the occlusal data, the mandibular data, and the maxillary data. This window helps us orient the occlusal plane. So first I click on the maxilla box, then I click here, maxilla, then dentate, then continue to align. Why is it important in this case that we do the orientation of the occlusal plane on the maxilla, not on the mandible? Because the mandible is missing these posterior teeth, so the occlusal plane won't be precise. So we have to select the maxilla. If we wanted to select the mandible, we simply select the mandible box. As you can see, it's highlighted in blue. Then we select the mandible, dentate, and continue to align. But in this case, we'll select the maxilla. This window will appear, showing us what the program sees is the correct orientation of occlusal plane. But if you could see, there's a slight shift in the midline, so I could select these widgets and move it a little, and we could also move it a little downwards. I think this is the correct orientation according to the model here. Then I'll click Finish. After knowing how to orient the occlusal plane according to the dentate option, we should know the other options, which are edentulous and partial. We should first go back and import a model with prepared teeth, so we can't orient the occlusal plane by the dentate option. Here's the model. This is a full mouth rehabilitation case in which all the teeth, upper and lower, are prepared. So there are no natural teeth, so we can do the orientation of occlusal plane with the dentate option. So we have to skip to the edentulous. Select the maxilla. It's highlighted. Select the maxilla here and edentulous. Continue to align. The program here will ask us to put these dots on the gum. So press Shift on the keyboard and with the left mouse button, click on this area. Now we have to click on this area, not on the tooth, on the gum. And finally, press on the other side on the gum. The software here will give us the initial placement of the orientation, but I could change it as I see fit. In such a case, it is preferable to take a post-operative picture to the patient so we can compare it with the model. I could change it a little and click Finish. This is the data after correct orientation. The next option, which is the partial option, first we have to import the models. As you can see in this model, the prepared tooth is only 1 molar, so we don't have to scan the whole arch. Scanning half an arch is appropriate. Now we select the maxilla here, and partial. Continue to align. As we done in the edentulous case, here the program will ask me to place 3 dots, but these dots have to be on teeth. So we press Shift on the keyboard with the left mouse button, press on this cusp, then at the tip of the central, and finally the other molar cusp. This is the initial orientation that the software sees. I could change it a little to what I see fit and click Finish. Here are the models oriented in a correct occlusal plane. Now, this is the window of the main program. It has the viewport, which has all the data that we imported, and it has this model down here, which has these arrows. If we press on them, they will indicate the direction of view. So it could be anterior, posterior, sideways. If I want to rotate the model, I press on the left mouse button, stay pressing, and move the mouse. If I want to zoom in and out, I press on the right mouse button and move the mouse. I could also do this by the scroller, move it up or down, which is the middle mouse button. But if I press and hold the middle mouse button and move the mouse, I can pan, which is move the whole view left and right, up and down. In the next video, we'll learn how to edit the scanned data and make a model out of it.